financial sector was so concentrated. So that doesn't always go in a free market direction, but it is sort of a broader principle. And finally, yeah?
I had a question about the doctors who are kind of tightening the supply.
Yeah.
Isn't there, aren't the results of their action kind of far out and gradual over time, such that when they think about tightening supply to increase wages, they can't really have an expectation to see immediate effects from that?
Yeah, I mean, that's an interesting point. My guess is that the Doctors Association, if not the individual doctors may not, but the Doctors Association may have a pretty long time horizon, because it's got a lot of people who've sort of been in the industry for a long time and who see the long term and want other people to succeed as doctors. So it's not just purely I myself want my wages to be higher, but also that I have sympathy for other doctors. And I'm used to being around doctors, and I want doctors to do well, and therefore I sort of have this broader collusive interest that comes out of the professional association. What's your name?
David.
David. Okay, so oh, sorry, did you have a question?
Yeah. A little bit, yeah. So isn't the fourth argument, can that also be argued for having these licensing associations? Because he doesn't mention in his arguments like independent government licensing associations rather than these like associations of pure doctors.
Yes.
So if there was an independent government association that made sure that the interest was of the people and not of the doctors.
I think there's a strong, sorry, what's your name?
Vlad.
Vlad. I think that there's a very strong case to be made that if you could sustain an independent association that wouldn't be controlled by the doctors, that would be superior to having no regulation. So I think that that's for sure true. But I think that the fear that Friedman has is that these associations too easily get captured by the industry because the doctors are thought to be the experts on doctors' work, right? So that's basically Friedman's concern. And another concern he has is that because of this effect that we were talking about, Max, about doctors having solidarity with one another and not wanting them to be competing too much with one another and wanting them to have sympathy for other doctors, that often leads to a compression of the wages that different doctors earn. If you think about like the dispersion in doctor salary versus what's true in finance or what's true in professional sports or something like this, it's much smaller because the American Medical Association is trying to avoid too much like trying to be the best, because that undermines the doctors working together to all raise their wages, right? And I think that one of the most extreme examples of that is teachers' unions. So teachers' unions are almost always opposed to any form of merit pay or judging of the teachers because they don't want the teachers to have to compete too hard with one another to provide services because that'll harm the teachers. Okay, so Michael Gonzalez. Hey, so what does Friedman advocate as the solution to this problem?
He advocates like not kind of, he talks about not having licensed doctors, having like certified sort of thing. So that would sort of differentiate between kind of good and bad, but it wouldn't kind of disdain one for the other. So it could sort of allow, like he talks about possible like group doctors or like areas in which you could actually spend more time with the doctor.
That's exactly right. And so why does he think that certification works better than licensure?
I think just because it allows people to make the decisions for themselves a little more than government regulation or producers, like the producer group.
Yeah, I think that's basically right. So I think what he thinks is that certification is beneficial because in the absence of certification by the government, any company that went around trying to certify people, the problem is the information that it provided to the public would sort of leak out and be available to anyone. So if I went around and spent a bunch of money figuring out which doctors are good doctors, which doctors are bad doctors, everyone would know that. I mean, anyone, even if you didn't buy the magazine that had all the ratings of the doctors, someone could ask someone else who had the magazine to tell them or something like that, right? And so that will not be supplied by a market because the person can't make the money associated with that. So it is beneficial to have certification. But the benefit of not having licensure is that then if the certification process starts getting totally corrupt, then people can just start ignoring it, right? And that's not only beneficial because it provides a check on how bad the certification process can get, but it forces the certifiers to actually do a good job so that they don't feel the competition breathing down their neck. Yeah?
He also talks a lot about the medical teams replacing individual practitioners.
Yeah, this was the group practice
Right.
that Mike was.
I thought it was interesting that he isn't really arguing that necessarily those will take over and everyone will be using
Yeah.
that, but that just having the option not only holds up the individual practitioner's certificate, but
Yeah,
gives a better option.
absolutely. What's your name?
William or Bill.
Yeah?
I think he also said something, I'm not sure if this is related, but he said something along the lines of limiting entry into professional schools. So for medical students, to have less get into medical school so that the licensing can still occur.
Yep.
And that happens at another time, and there's less, I guess, less privileges, less income.
Yeah, so he emphasizes that medical schools spend a lot of time, actually do a lot of the filtering themselves, right? Yeah. What's your name? I think we should probably go on, actually, unless, do you guys have something very important to say?
Sorry, can I just say?
Okay, sure, go ahead.
Isn't a lot of the idea that it places the onus on the consumer as opposed to the producer, so that in this case the decision for what is important is placed on the consumer, so it diffuses out the decision.
Yeah, that's an important part. What's your name again?
David, the other one.
David, what's your last name?
Fetterman.
Oh, yeah.
I'm just going to make a paternalistic argument that Friedman poo-poos in
Yeah.
this. Because I think times have changed, and now search costs for doctors, to find out who a doctor is, who's a good doctor in the field that you want, is going to be much higher because we have to invest more time in knowing what this doctor can do and can't do, and with technology advancing at such a rapid pace, it's very hard to expect the consumer to know exactly how good this doctor is and make an informed choice that way.
What's your name?
My name is Terrence. I just switched into your section, so like 5 minutes ago.
Well, so I would actually disagree with that. The reason is that I actually think, if anything, technology has made it easier to search. I mean, the amount of, think about what you do for restaurants. It used to suck trying to find a restaurant. You had to buy Zagat's, you had to go to all these centralized services. Now Yelp does a fantastic job, right? And Angie's List does great things for doctors. In fact, I think it works a hell of a lot better than the licensure system. So I actually think that the greater availability of information has actually gone in the opposite direction, I would probably guess. But, did you?
Yeah, no, so I was going to say, because I think Friedman also argued that you don't choose doctors by randomly doing so
What?
I think he talks about how you don't just randomly pick doctor
Yeah.
by license.
Yeah.
That's a recommendation from friends or
Yeah.
whoever. So
What's your name?
my name is also Terrence.
Terrence. What's your last name?
Well,
Q?
K-W, okay.
Okay, so, Cody, do you have, do you remember what, or can you think of some applications to today's world of these types of ideas? Like what types of issues in the medical sector right now do you think?
Cancer.
So go on.
Trying to find a good doctor for chemo. Proton therapy doctors. Just different fields are open now with technology. So there's a more range of doctors to choose from.
Yeah, so that's an interesting point, and that feeds together with, I think, some of the issues that have become big in public debate recently, which are that the medical system is costing just an enormous amount of money, and it's on the verge of bankrupting the country, right? And one important reason, maybe not the main reason, but an important reason for that is that doctors earn so much, and there's so few doctors that it's really hard to provide quality care to so many people. And I think even worse than that is that the American Medical Association works very hard to prevent innovation for technologies that would replace doctors. So it's not just reducing the supply of doctors, but reducing the amount of medical, electronic medical records and other ways of tracking patients' health that would allow diagnoses and recommendations to be made without the doctors actually having to do the prescription themselves. So one personal story about this was that my wife was hit by a car when we were rollerblading in Los Angeles, and she went to the hospital, the LA County Hospital, and she spent about 5 hours there waiting for a doctor to stitch up her lip. She just had to have a few stitches put into her lip. And that, in California, is illegal for a nurse to do. And so she ended up waiting there for 5 hours with this open wound, got an infection that she ended up dealing with for several years, basically just as a result of the fact that in California it was illegal for someone to do something that probably a doctor isn't even ever trained to do, namely stitch up somebody's lip, right? So that's, I think, an example of the sort of perverseness that comes out of a system which limits the entry for things that obviously don't require any of the requirements that you need in order to become a doctor, the many years of school. This thing seems to have gone down. Oh, there we go. Okay, great. So, so for the purposes of this class, I think the most important thing about this article was that there are a bunch of sort of tools you're going to learn in this class that Friedman uses in making his argument. So some examples of that are the notion that when we design public policy interventions like certification, it's really important that they be focused on the exact issue that they're trying to address. That is, if you want to certify people for quality of doing stitches, certify them for doing quality of doing stitches. Don't put them through a whole bunch of random communist screening or something like that, right? And that's going to be a theme that we'll come back to in lecture 7. Another idea is that we can tell something about what someone's motivation is by how they act. So the fact that it's the producers lobbying for this, not the consumers, indicates it might be in the producer's interest rather than the consumer's interest. We'll come back to that in lecture 8. Another crucial part of his argument was the idea that a monopolist will try to reduce quantity in order to raise price, and that will exclude people from the market and reduce social efficiency, which will be the focus of lecture 9. Another thing that we'll talk about when we talk about competition policy is why it's much more important to look out for consumer than for producer interest because of the greater diffuseness of consumers. We'll talk about that in lecture 16. And more generally, we'll talk about what's called the collective action problem in lecture 17, which is the fact that when people are very diffuse, it's very hard for them to get together and do anything that benefits all of them together. Vlad, do you have any thoughts about other things that came up in this that you think used economic reasoning that we might cover in this class?
Well, one thing I was thinking about, maybe it's like a tool, is that when he's talking about how other people can be in the medical field, oftentimes people just buy drugs over the counter and try to heal themselves through their own knowledge rather than going to doctors.
Yeah.
So maybe thinking about these problems from a personal or anecdotal perspective.
Yeah, that's interesting that people might sort of substitute into an inefficient, private use rather than that's sort of what you're saying, right? Mm-hmm. Yeah, that's interesting. Yeah.
Yeah, that along those lines, I kind of brought up public versus private goods in my mind, especially relating if the government would start providing the resources necessary or any debt in those circumstances, and also just how if it were up to the consumers to choose what they were given or what kind of